Hi, this is Shannon. My genetic disorder I will be covering today is called Duane syndrome. What is Duane syndrome? Isolated Duane syndrome is a congenital disorder that affects horizontal eye movement. It limits eye movement with adduction or inward toward your nose and abduction, so outward towards your ears. Why does it occur? In the early stages of embryonic development, miswiring of the eye leads to the absence of one of your brain's nerves called the cranial nerve. It's the sixth one, which causes the Duane syndrome. In 90% of the cases, Duane syndrome is sporadic and not inherited, and the other 10% have had other family members with Duane syndrome. Causes. It's a sporadic disorder. There's no reason why it occurs. That's why it's really rare and why we don't know why it occurs. During adduction, so inwards toward your nose, the eyeballs will pull back into its socket just a little bit and the eyelids will narrow. So what that means is your eye will get like smaller and the eyelids will close a little bit more. That's really what it's saying there. Their head tilts to accommodate their tilted vision. So if they're adducted, their vision will be slightly tilted, so then they will tilt their head to accommodate for that. The eyes will drift, which will mean it'll just move in the direction involuntarily that it is able to. So if it can't adduct, it'll abduct, drift, and vice versa. And that also causes for misalignment of eyes, kind of like a chameleon, where you can kind of be looking in two different directions at the same time. How common is it? Duane syndrome is a really rare genetic disorder. Affects less than 1% of people worldwide. There is no specific ethnic group or race that is more likely to get it, but it is more common in girls than boys for whatever reason. There are no famous people that have Duane syndrome besides me. Cures. There are no cures for Duane syndrome, but surgeries are helpful as they can reduce symptoms such as the head tilting, because they can realign your eyes there, and retraction. It can like pull it out just a little bit more. In this video, it's a professional doctor going to explain Duane syndrome.
Hi, I'm Dr. Julie Steinauer. I want to talk to you about another interesting condition we've been seeing a lot in our clinic lately. In fact, we have a handful of patients, and just this weekend I actually ran into two other individuals who have this condition. It's called Duane syndrome, and Duane syndrome is not something that you hear of very often. It's not very common. However, there are three different classifications or different types of Duane syndrome, but essentially in all of them, one eye has difficulty either moving out and is kind of like almost paralyzed or stuck. It can move in, but it just can't move out. In another one of the levels, it's the opposite thing, where it's not able to move in, but it can move out. Okay, and then there can be kind of a combination. We also will see things where we get like a narrowing of the what we call the palpebral fissure, which is basically the area between the two eyelids will narrow, and one eye will sometimes retract back into the globe in efforts of trying to pull the eye one direction or another. So Duane syndrome is really interesting, but we just have to break things down to make it simple at Vision for Life. And I usually just say that no matter what someone walks in with, whatever initials or letters they have coming in with any type of condition, is this something that is treatable and correctable with the brain, or can we improve things with the brain? And we actually can with Duane syndrome. And so we've seen some changes with our photosynthetic light therapy in changing how the brain is able to process information, even though it's an electrical component problem, in kind of like I would call it like the warehouse of the nerve. And so even though that is going on, we can still have some significant changes and improvement and benefits for those patients with Duane syndrome. So for more information about how we treat strabismus, go to visionforlifeworks.com.
All right, thank you, Dr. Julie. And here are my sources for this project. Thank you for your time and watching the video.